Hi, my name is Jessica Soul. I'm the Director of Strategic Partnerships here at East Hill Medical Center. This month, we are celebrating our 50th anniversary. We actually started in February 1971. We have 50 years of impact, and to celebrate, we're going to be doing a series of videos that we'll be posting on our website and social media. We're pretty excited about it, and we've got some surprises. What is now East Hill Medical Center began with casual conversations in the 1960s about concerns over the growing rate of unplanned pregnancies, especially among young women, and the economic, physical, and emotional strain on families with several younger children. Those talks over coffee later led to the creation of the Cayuga County Family Planning Center in August 1970. The Reproductive Health Center opened on James Street. The agency was funded by the Office of Economic Opportunity to provide family planning to all interested, and the staff included outreach workers, educators, and medical staff. The family planning philosophy is not to cut down the number of children necessarily, but rather assure better spacing to reduce physical stress, financial burden, and conflict in families. By November 1970, the doctors were having a difficult time keeping up with the need from the community. In February 1971, the organization officially incorporated with approval from the state. This marks our first year on the journey of 50 years of impact. In those early years, the Family Planning Center moved to the Murphy Building on Genesee Street. By the organization's 5th anniversary, it had moved once again to State Street and opened a satellite office in Cato. The Family Planning Center provided resources and education to couples looking to conceive, as well as couples and women who were looking for reproductive health and assistance in planning the timing of their children's births. In 1973, there were 228 pregnancies in Cayuga County for women 19 and younger, according to a January 1975 Citizen article. That same year, 1975, almost all school districts in the county had educational guides for teenagers about pregnancy and sexual health created by East Hill. At the beginning, the Family Planning Center did some educational presentations, coffee hours, education in schools, and door-to-door communications on women's health, counseling, and family planning options. In the coming years, and well into the 80s, the Family Planning Center expanded into providing medical services, such as well woman visits and STD testing. Over time, the organization offered prenatal care, cancer screenings, and HIV testing. As word spread, the center's patient base rose steadily. Within a few months, providers were having trouble keeping up with the demand in the community. In 1978, 1,200 women visited the Family Planning Center for pregnancy tests alone. By 1979, the center had served 1,680 patients. The center's education arm continued to offer outreach in response to a nationwide spike in teenage pregnancy in the late 70s. At the same time, there was an emphasis put on prenatal and postnatal care for young moms. Certified health educators answered questions on local radio shows, conducted seminars on a variety of topics, including menopause, puberty, and healthy relationships, and even had a hand in developing programming at the Cayuga Community College. By the mid-1970s, the Reverend James Enright, a Cayuga Health Planning Committee member, called for the creation of a public health corporation to oversee the provision of a coordinated healthcare system in the county. This is a precursor for what is now East Hill Medical Center, as we grew to be a foundational primary care provider. By the early 1990s, the idea had taken hold, and the Family Planning Center transitioned to primary care. By 1994, the switch was complete, and the organization, now known as East Hill Medical Center, took shape. We'll talk more about the journey of primary care in later videos.